The BRICS TB Research Network Innovation Summit kicks off in Durban today, and the main aim of the summit is to facilitate collaborative scientific programs that focus on innovations in TB diagnostics, vaccines, therapeutics, drugs, infection control, and patient service delivery. At least 20 member states will be part of the summit to highlight the plight of TB in Africa and, in fact, around the world. Let's get you a sense of what else to expect. Bring in Dr. Norbet Ndjeka, who's the head of the National TB Program with the National Health Department, and joins us via our video link this morning. Dr. Ndjeka, it's great to have you on board. Thanks very much indeed for speaking to us. You know, it's an incredibly important summit, and I'm hoping you'll help us place the significance here, especially because between 2010 and 2019, there had actually been a steady decline in global deaths due to TB. But sadly, we've seen some of these being reversed during the COVID-19 years.
Yes, indeed. We're excited to have this meeting with our colleagues from the other BRICS countries, Brazil, Russia, India, and China. It's exciting. The summit is really to look at innovations to end TB. We want to end TB. We're committed to end TB. Sadly, COVID reversed some of our gains, and we are on path to recover from these losses incurred during the COVID years.
And where would you say some of the major gaps still lie, Dr. Ndjeka? Because as already mentioned, I mean, TB is something that we had seemingly been making strides against, and yet, at least according to the information at my disposal, it's still one of the leading cause of death in South Africa.
Yes, TB is the cause of death number one. It is the single most killer disease in the world. Is number one cause in South Africa. It remains to the number one, but the numbers are coming down. They've been a decrease over the years, but not the way we want it to be. You know, we only had 17% decrease from 2015, but we wanted it to be at least 35%. So it's coming down, but where we're winning more is the incidence. The incidence is dropping fast. We managed to close the gap between those that we find and put on treatment and the actual number, the estimated number. We dropped from 160,000 per year in South Africa to just below 70,000 per year. It's still not what we want, but from 160 to 80,000 is 50% decrease in terms of new people we find with TB every year. So that is one of our major success.
And, you know, when we come to, look, awareness is a big part of it, right? Ensuring that people who are even having symptoms of TB are able to present at a time when there's still something that can be done about that. To what extent do you reckon we're winning the fight on that front?
Our awareness is a big problem. We are very slow on that one. For example, last year, we decided that everybody that get the TB test in South Africa should receive a SMS so that they know whether they have TB or they don't have TB. If they have TB, they got to come for treatment, and we're not doing well. We're winning on that almost 50%. The other 50% don't get. So it's a problem, and we really we have a new strategy on how to communicate with our people on TB. We want to put it in implementation next year because we feel that we need to communicate in the way that we create demand for TB testing. We create demand for linkage to care, for retention in care, but also prevention is critical. So we're really going to be doubling our efforts in those areas moving forward.
Yeah. You know, it's going to last until Thursday, this particular summit. And I have to ask you, Dr. Ndjeka, what a successful summit looks like, at least for you. You know, there's sometimes a tendency to get all the right minds in one room, and there's a perfect diagnostic of what the problem is. But the solution sometimes feels very elusive at the end of those engagements. So as far as you're concerned, what would you reckon would be the hallmarks of a good summit come Thursday?
Thank you so much for asking that. So the summit, like I indicated, is really to look at innovation for ending TB. So what we're doing, we brought in top-notch scientists. We have so many of them in the BRICS, so many of them in South Africa. But we have a sample from South Africa of some of the best guys, and that's what Brazil and India and China have done. So we'll be discussing ideas. We'll be looking at program. So the scientists will bring some of the ideas new, fresh from the box on, for example, how do we bring the numbers down? TB vaccine is critical. So we hear some ideas from Russia, from India, from Brazil, from South Africa on how can we come up with a vaccine. The idea of a vaccine that is not even yet in place, we need to begin thinking about that. We'll be looking at a program. What are we doing best within the program, on the ground, in the real world? We also have a young scientist, one or two from South Africa, who will be telling us from their age, from their, inexperience, but they're good scientists. What do they think we should be doing? So we put all this together. Our success will be to identify 2, 3, maybe even one big project where we can recommend to our bosses, to our minister, to our presidents within BRICS to say, if we do this or that, if we find money to do this, it could help us really move further. But we also come together in terms of best practices. If we can do 1, 2, 3, we learn something from India, from Brazil, it will push the program. They also would like to learn some of the things from us. So really it's about science, big science that will push us fresh from the box, sharing practices, but also looking at collaboration, where 40% of TB as BRICS countries. So we should bring the solution. We brought the problem, a lot of TB, we should bring the solution. And if we collaborate in research, in how we'll be working, it's going to be a success, big research that we find new ways of working together. We should be able to that's what I'm going to call a success.
It's an important gathering, and thanks for helping us think through some of the issues that you're hoping to get through between now and Thursday. The head of the National TB Program with the National Health Department is Dr. Norbet Ndjeka. Thanks very much indeed for your time.